COVID-19 response, it started right when Seattle began to shut down. As many already know, Seattle was one of the first places that COVID-19 was detected. Our King County Public Health operation reached out to us very quickly to ask us to be a part of the response and education and give them feedback and information so that it is done equitably.
We created a speakers bureau with over 150 scientists. Actually, we had over 200 scientists in that speakers bureau. 120 of them were Black. And so having experts on deck to provide to speaking events at local communities to ensure that people were hearing voices and hearing experts that look like them. I couldn't be everywhere.
I was able to create vaccine educational materials that spoke to exactly what the community was sharing with me that they needed. And so the Black Health Matters initiative really began as a guidebook. So a 20-page book called Black Health Matters, and it is very in-depth. It's everything that I learned about the vaccine, and it's everything that I would have needed to hear and that I think people around me needed to hear.
It was extremely important to partner up with our community leaders to be able to deliver trauma-informed, community-driven and led information. We also know communities may not trust very large government entities, healthcare entities, so to be able to partner with our trusted community leaders to be able to deliver that health information in a way that resonates, but also from a trauma-informed lens, it landed better.
And then we made sure that our kids had the information when they were getting ready to go back to school, and the parents on why it was important to make sure that our kids were vaccinated when it was available.
I've been in this pediatrics business long enough to know that it's just not easy to just come to a mom and say, hey, let me just inject your child with something and let's all hope everything's going to be okay. This requires relationships and important conversations. Those are conversations that can only happen in certain circles and only when they're hosted by certain organizations like the Seattle Urban League.
As COVID hit us, we started looking outside as to kind of who's out there doing good things, and Urban League has always been in my mind, but having a booster and COVID testing opportunity at our Seattle location and then as well as in our Renton location became kind of the start of us doing something together. We felt that it was something that the community needed, especially when cases were on the rise, and Urban League being able to amplify that voice, providing the connection with a clinic, a trusted clinic here locally to administer, and us being a hub, a space to allow that and to provide and to support that to happen was the start of it all.
When I was on site at a community vaccination clinic and I sat and I listened to a military service member talk about PTSD and how COVID was triggering his PTSD, we sat down and I said, come out of line. You don't have to, you don't have to get vaccinated today, but let me talk to you about it, and let's just have a conversation and let me get to know you. And we spoke for like 30 minutes about life, a little bit about vaccination, but life. But at the end of it, he was like, I feel so much more firm in my decision, and it's really because you were here to hold my hand and make me feel so comfortable.
I don't take these clinics lightly. I don't see it as just any other day, any other experience. I see these as really potentially transformative moments because a lot of the people I talked to, they hadn't been to a healthcare clinic in 10 years, or they avoid the doctor at all costs until they have to go to the emergency room. And so for them to show up to a vaccine clinic, it's a big deal. And so I want to show them healthcare can feel good. Healthcare can be for us, by us. There are nurses and doctors and researchers that look like us that we can talk to and really start to transform and heal what that relationship with healthcare can be like.